On this episode, we'll talk about upper endoscopy after the gastric sleeve. We'll also talk about the time needed to be off work, and we'll also be talking about cramping pain after a few months out of your gastric sleeve. Everyone, welcome to the AskDrA show. This is episode 43 and excited to be here with you. I want to big thank you, big shout out to the Obesity Help staff and community. Thank you so much for supporting the AskDrA show and helping get this message and questions and answers to more and more people out there. So if you don't know how the drill works, remember that you're welcome to send your questions using the hashtag AskDrA via Facebook, Twitter, YouTube, Instagram. And you can also send me questions directly to my Snapchat, okay? So the username is on the screen here. So also big shout out to my patients, former patients, future patients, patients from other doctors. We're going to be in Atlanta April the 30th, all right, at the Southeast VSG conference. So if you're around or near the Atlanta area, I'd be very happy to see you there and say hello, all right? So Atlanta at I think it's going to be the Crown Plaza, April the 30th, Saturday throughout the day. And I think we have some activities also on Sunday. All right, so Atlanta area, I hope to see you there. Let's jump into the questions.
What is the recommended time frame for an EGD after the surgery?
All right, so let's talk about upper endoscopies and when is it safe to have a study like this after your sleeve. Normally we sometimes have done these procedures, but it's more like right after a few days, which is not recommended, all right, don't get me wrong. Right after any strictures, complications, leaks, and the endoscopy can be done immediately right after surgery, although it is not recommended on a normal evolution of a recovery of a gastric sleeve patient. So let's say you have a normal sleeve, normal recovery. I wouldn't recommend having an upper endoscopy in the next 6 weeks, all right? So I wouldn't recommend it at all. At least let 6 weeks go by and then get it. Now, let's say you need to get it. Well, 6 weeks is good, but if you can wait the 6-month period, that would be even better. All right, so no sooner than 6 weeks, unless there's a complication or a certain indication your surgeon wants to get it done. Otherwise, wait 6 weeks. Better so 6 months.
How long is it okay to take off of work after the surgery?
Okay, so the question, and this is a very common question we get, how much time do I need off work? Normal, a desk job, 3 to 5 days. Normally patients are back at 5 days or between 3 and 5 days. Let's say that's the average. Some people need a little bit more. 7 days would be awesome. 10 days is, believe me, more than enough time. Remember, this procedure is done laparoscopically, tiny incisions, and recoveries fairly quickly. Patients are getting up to the restroom 2 or 3 hours after surgery, at least with our technique. So 2 or 3 hours after surgery, up and walking. That same evening, patients are walking up and down the hall. So the recovery is very quick. It would require a little more extra time if your job requires to heavy lifting. Otherwise, if it's just desk job, 3 to 5 days.
Every time I eat, I get an almost cramping pain on my left side. What could be that?
Okay, so a cramping pain after 10 months is not normal. You need to make, I would first of all check with your doctor and then make sure maybe it's your gallbladder. If you don't have your gallbladder, if it's previously taken out, make sure their sleeve is good. Maybe at this point it's a good time to get an upper endoscopy and check your sleeve out, but it's not a common situation to have a pain this far out, okay? Normally patients may have this cramping sensation, this pain, the first few days after surgery, which is not everybody gets, but the first few days, a cramping sensation, once you start doing the ice, once you start doing clear liquids, 2 or 3 days out, and then it disappears. But 10 months out, I would check with your surgeon or your doctor just to make sure everything's good, get an ultrasound of your gallbladder, make sure that it's not another issue other than your sleeve. All right, so there you have it. This is episode 43 of the Ask Dr. A show. Thank you so much. Don't forget to subscribe to our YouTube channel. That way you don't miss any of the future videos. Don't forget to add me on Snapchat. Say hello. Send me your snaps. And if you have any questions, don't forget to use the hashtag AskDrA. Atlanta people, I hope to see you soon on April 30th. See you soon. Take care. Almost forgot, question of the week. How long did it take for you to return back to work? I want your answers down here. It's a really good, interesting poll. So how long did it take for you to be back at work and how did you feel? Questions below on the comment section. I'm looking forward to hearing from you. Take care. Bye-bye.